So yesterday we talked about capillaries. So very important topic because the blood reach to the arteries and veins, then to the capillaries, from the capillaries to the cell. Okay. So whatever necessary things like oxygen, glucose, proteins, everything will be to be reached to the cells. Okay. Then only the normal function of the cells or any organ will be happen. Okay, in that process we need blood pressure, the pressure which allows the blood to reach to the target area, first thing. And second thing is that whatever necessary thing they have to be reached, and they cannot become backward. Okay, only unwanted things, unnecessary things to be returned back. So in that process we need albumin to maintain the pressure, whatever pressure, attracting pressure or pulling pressure. Okay, so all those things we discussed yesterday. Today we will discuss paths of circulation. So what are the different paths in our body? What are the different paths of circulation? One is pulmonary circulation, and another one is systematic circulation. Okay, and in the systemic circulation we have the all the body circulation, and we have hepatic portal circulation and fetal circulation. Okay, so in that, we will discuss all those 3 to 4 types of circulation. First, we will discuss pulmonary circulation. Pulmonary circulations, we know that from the heart to the lungs, lungs to the heart, and from heart to the all parts of the body. Okay, so this is the basic information. The right ventricle pumps blood into the pulmonary artery. So we have to assume that this is the heart. Okay, these are the 4 chambers. Okay, this is the right side of the heart. This is the left side of the heart. Okay, this is the right side of the ventricles, ventricles, auricles. Okay, so this is the ventricle, right side ventricle through the pulmonary artery. Okay, one going is to the lungs. Okay, so assume this is the lungs, so it will go to the lungs, this artery. Within the lungs, each artery branches extensively into smaller arteries and arterioles. So this is the largest branch, and from there we have the arteries, small arteries, which will reach each part of the lungs. Okay, then into capillaries. So the first large artery, then arteries, then arterioles, then capillaries. So most of the cells are attached to the lungs with the help of capillaries. Okay, the capillaries only attached to the lungs. This is very important. So here, what will happen? The pulmonary capillaries surrounded the alveoli of the lung. So the basic unit of the lung is alveoli. This is sac-like structure, like grapes. Okay? You saw the grapes, how the grapes are there. So it is like structure. Okay. In a respiratory system, we will talk in detail. Here we have to understood only one thing, that is alveoli. This is alveoli. So each capillary is attached to the alveoli. This is alveoli. Okay, this is capillary. Okay, the pulmonary capillaries surround the alveoli of the lungs. It is here that exchange of oxygen and carbon dioxide take place. So here what will happen? One capillary will take the oxygen and it will reach to the arteries, and one is whatever from the venous system, whatever capillaries are attached, it will give the carbon dioxide to the alveoli. So taking of oxygen and giving of carbon dioxide will happen. So what will happen? The capillaries will are attached to the venules. it, the capillaries will attach to the arteries, will give the deoxygenated blood and take the oxygenated blood from here. Okay, so it is attached to the venules. So from venules to veins, veins to pulmonary vein. Here we have in the left atrium we have pulmonary vein. This is pulmonary artery which reach to the lungs. pulmonary vein which reach to the left atrium. Okay, the return to the left atrium. Okay, here return this oxygenated blood. So here we reach oxygenated blood. Then they travel through the systematic circulation from the left atrium to left ventricle to the aorta. So here aortic wall, the wall will open, contract when the contraction happens. So blood goes to the systemic circulation. Okay, so this is the thing we have to remember. So this is the pulmonary circulation, because here pulmonary uh, oxygen is, sorry, lungs is attached to the heart. So basically first type of circulation will happen in the body is pulmonary circulation. Next is systematic circulation. Okay, systematic circulation, the left ventricle from here, left ventricle pumps blood into the aorta. So from the heart, left ventricle, it will reach to the aorta. This is the aorta, na? The largest artery of the body. So this is the very large artery of the body. We will return to the aorta and its branches in a moment. But first we will summarize the rest of systematic circulation. The branches of aorta take blood into arterioles and capillary network through the body. Capillaries merge to form venules and vein. The veins from the lower body take blood into the inferior vena cava. Veins from the upper body take blood to the superior vena cava. These two caval veins return blood to the right atrium. The major arteries and veins shown as clear. The aorta is, so basically everything is studied. Here what explained that this aorta will make branches and it will become arteries, arteriole, and capillaries to the rest of the cell. From again we have the capillaries are attached to the venules, veins, and superior vena cava. Superior vena cava, inferior vena cava will brings blood back to the right atrium. From right atrium to right ventricle to the pulmonary, through the pulmonary vein, pulmonary artery it reaches to the lungs. From there, pulmonary vein to the left atrium to the left ventricle to the aorta, arteries, arteriole, capillaries, and cell. So this is the systemic circulation which happened throughout the time. Okay, which we have to remember. Okay, this is the basic circulation which happened all over the body. Okay, next we will discuss here the aortic. So here all details about systemic circulation, how it reaches to the every part of the body. The aorta is continuous vessel, but for the sake of precise description, it is divided into sections that are named anatomically: ascending aorta, aortic notch, thoracic aorta, abdominal aorta. So here we have the aorta. The aorta is very big artery. Basically, all over the body, it is aorta only. Okay, wherever it is reaching, aorta, arteries, arteriole, and capillary. But different body areas it reaching, we named as different aortas. So ascending aorta, aortic arc, thoracic aorta, and abdominal aorta. So first we will discuss ascending aorta. Ascending aorta is the first inch that merge from top of the left ventricle. The arch of aorta curves posterior over the heart and turns downward. So the ascending aorta will go upward. Okay, it will go brain. It will give the blood to the brain. Okay, face, neck, everything. Ascending aorta. Okay, ascending aorta upward. Next is aortic arc or aortic curve. It will give heart, and it will turn downwards and become thoracic aorta. Okay, here you have the image. Yes, you can see that this is the aortic arc. So it is reaching to the heart only, and it will going downwards. This is the downward. You are seeing that. So it will become here So this is aorta and will go upward, ascending aorta. It will become ascending aorta. Okay. And here we have Iotic arc, and it will pump to the heart itself, and later on it make the branches and curve here. Okay, and it will have division. The area which reach to the abdomen, it will called abdominal aorta. The area which is a thoracic, this is a thoracic. Everything is reaching lungs, heart, everything, pericardium, whatever organs are there in the uh, thoracic region. Okay, it will become thoracic aorta, and it will become abdominal aorta. Okay, understood. From there are multiple branches are there. So everything is given here only. So everything is about this circulation. So from that we will discuss. Here you are seeing that this is the aorta, and it making one branch upward, ascending, and it will be making one branch here. Okay, two sides, bilateral. So this is the branch. This is called brachiocephalic artery. Okay, and it will going upwards. This is vertebral, backward vertebral arteries. Okay, to the neck region and occipital region. Okay, and here we have another artery which is going upward. This is called common carotid artery. What is called common carotid artery, and this is external carotid artery, and this is making branches here. So it is become facial and maxillary. This is the facial, which is going upward all through the face. This is maxillary. Here we have maxillary. Okay, and it will going one making one branch here also. This is called occipital, and it is making one more branch we will discuss later to the all the cerebral arteries. Okay, let's come downwards. So next we have upper limb. So this aortic arc is making one branch here also. This is called brachiocephalic artery. What is called brachiocephalic artery? Okay, brachiocephalic artery. Next it is coming downwards. Here we have named as axillary artery, or it is here the clavicle bone, na? Thus we will call subclavicle artery. What we call here subclavian artery. Okay. Next, some more downward you have to come. This is called axillary artery. Here from axilla, because of axillary region, will call as axillary artery. Next, we have this. We reach to the. This is the arm region. We have muscles. Okay, so we have brachial muscles. So we named as brachial artery. Next, we are reaching downwards, radial artery. This is make another here making two branches from the elbow region. Okay, radial artery and ulnar artery, which brings towards the thumb. That is radial artery, where we check the pulse. Okay, this is radial artery, which it is going away to the little finger. That is named as ulnar artery, and after that it is making more branches, palmar branches and superficial palmar branches, deep palmar branches or arc, and superficial palmar. So this is the arm region arteries and facial arteries, or neck and head region arteries. Okay, next we have thoracic region. So you reach thoracic region, we have the number of here also thoracic artery. Where is thoracic artery? Or it's called intercostal arteries. Okay. Next we have, this is the celiac artery, and this supply the celiac region. Left gastric artery will supply all the abdominal region. Hepatic artery which supply liver. Splenic artery which supplies spleen. Superior mesenteric artery. Here the whatever the intestines are present, it will supplied by superior mesenteric artery. Abdominal aorta. Here this is the abdominal aorta, and it is reaching all the making branches here. And after that, this is making two divisions: right common iliac artery, left common iliac artery. Then afterwards, here we have one more branch, which is common internal iliac, which supply the gonadal region. Next, we have external iliac, which will reach back side of the buttock. Okay, so these are the common. Here also common. Here also common. Next, we have renal artery also there. Gonadal artery will supply uh, kidneys and gonadal region. Next, this is the common iliac artery, which is making branches here and become femoral artery. Femoral artery, which we check the pulse here also. Okay, from that region, doctors will take the if all the veins and arteries are not seeing to the patient, what they will do? They will take the blood from this region because of it will present, it will palpate. Along with that, some in some hospitals you've seen that to the emergency patient, or else what we call emergency patient, coma patient, they will insert one line, central line, means it they will attach the needle here to the carotid artery. Okay, or here in the COVID times, I saw many patients to taking samples of ABG, arterial blood gas. So they insert needle and take the blood sample to check the uh, bicarbonates, sodium, potassium, and oxygen level in the blood. How much amount of oxygen is reaching to the blood level. So they will take the blood samples from that region. Okay. So basically, so these are the arteries, femoral artery. Next we have popliteal artery, which is supplying to the patella, back of the knee, posterior knee, anterior knee. From that region, we have two branches, that is anterior tibia and posterior tibia, and reaching to the foot region. So these are the arteries, veins. Here one is important, that is which in the brain we have Hmm. we have in the brain we have a junction where all the arteries, veins, only mostly arteries will go. This junction is known as circle of Willis. What is named as circle of Willis? This is very important when we study MRI, or they will do MRI to know about this. So how the blood circulation is happening here. So we'll talk about something about that circle of Willis. Circle of which is circle of arteries around the pituitary gland. The circle of Willis is formed by the right and left internal carotid arteries. So carotid arteries are going here, right and left pituitary gland. Okay, here we have inside that. Okay, so these are making one circle formed by the right and left internal carotid artery and basilar artery, which is the union of right and left vertebral arteries. So vertebral arteries are coming, carotid arteries are going, basilar arteries also coming. The brain is always active evening, even during sleep, and must have a constant blood flow, blood to supply oxygen, remove waste products. For this reason, there are four vessels that bring blood to the circle of Willis. From this anastomosis, several paired arteries extended into the brain itself. The thoracic aorta and its branches supply the chest wall and the organs within the thoracic cavity. So here, why the circulus of Willis is important for us? Because the brain needs blood circulation always. What does brain need? Brain need blood circulation always. So there's the reason the blood is circulating to the brain through four arteries: carotid arteries, vertebral arteries, basilar arteries. So you can see that this is the carotid artery which is reaching here and making branches to the all part of the brain, and basilar artery also. Okay, vertebral arteries from backward, frontward, right, carotid artery, vertebral arteries, and from side we are reaching basilar arteries. Okay, so we studied about systematic circulation, everything, whatever I told you, they are making branches, all those things discuss, and we have the number of list here. We have to all the arteries names and branches and supply. We need to by heart all those things. Next we have hepatic portal circulation also studied. Just we'll go through that. Hepatic portal circulation is a subdivision of systematic circulation in which blood flow to the abdominal digestive organs and spleen circulates to the liver before return to the heart. Blood from the capillaries of small intestine, pancreas, and spleen flows into the large vein. So I think all those things we discuss. Some important things here. Okay. The portal vein. The portal vein takes blood into the liver, where it branches extensively and empties blood into the sinusoid, the capillaries of the liver. From the sinusoid, blood flows into the hepatic vein to the inferior vena cava and back to the right atrium. Notice that this is the pathway. There are two sets of capillaries, and keep in mind that it is capillaries that exchange take place. Let us use some specific example to show the purpose and importance of portal circulation. So, because here portal circulation is very very important. Why? We will discuss here. Where is the portal circulation? I will define you something. Here we have veins also which are reaching to the liver. There are arteries also which are reaching liver also. Okay, what will happen when glucose from carbohydrate digested and absorbed into the capillaries of the small intestine after a big meal? This may greatly increase the blood glucose level. If this blood were to go directly back to the heart and then circulate through the kidneys, some of the glucose might be lost in urine. However, blood from the small intestine passes first through the liver sinusoids, and the liver cells remove the excess glucose and stored in it is glycogen. The blood that returns to the heart will then have a blood glucose level in the normal range. So basically, what will happen if it will not go to the liver? What will happen? It will digest the food, and it will enter into the circulation, and through the heart, it will reach all parts of the body. Then our blood glucose level simultaneously suddenly increases. So what will kidney do? Kidney will remove all the glucose from the body through the filtration process. But here what will happen? It will not happen. What will happen here? First, digestion happens, and the glucose or carbohydrates, whatever we are absorbed, it will reach to the liver cells. Okay. It, however, blood from the small intestines passes first through the liver sinusoids, and liver cells remove the excess glucose and store it is as glycogen. So first it will enter into the liver. So what will liver do? Liver will store excess amount of blood glucose which are not necessary to the body. Now, so whenever necessary, it will give to the body. So that's the reason our whatever we eat, suddenly glucose level increases, but after digestion, what will happen? The glucose will stored into the liver. Okay, so this is the important thing. There's the reason here uh, portal circulation is important. Another example is given. Alcohol is absorbed into the capillaries of the stomach. If it were to circulate directly through the body, the alcohol would rapidly impair the functioning of the brain. Portal circulation, however, takes blood from the stomach to the liver, the organ that can detoxify the alcohol and prevents its determinant effect on the brain. Of course, if alcohol consumption continues, the blood alcohol level rises faster than the liver capacity to detoxify, and the well-known sign of alcoholic intoxication appear. So here, second example also given, one is daily routine things are given, that is what will we eat. Second thing is that here uh, alcohol consumption. So we took alcohol consumption or whoever, what will happen? Alcohol is very danger to the brain cells. Mostly, it will degenerate brain cells. So what will happen? Liver will detoxify. It will remove all the harmful substance from the liquid to protect the brain from harmful effect. Okay, but if the alcohol capacity is more, if the alcohol capacity is more, so liver can't be detoxify more things like that. Okay, but it reach to the brain and it will damage the brain. Okay, it will damage the brain. So that's the reason the patient who are taking alcohol, their liver damage occurs because the blood reaches first to the portal circulation after digestion. Okay, so this important is things we have to remember. Next, we have fetal circulation. The fetus means the before delivery, whatever in the mother in the uterus is known as fetus. Okay, whatever baby is there. Okay, it is named as fetus in the womb, mother womb. Okay, so how the circulation, how the nutrition, how the development of fetus occur? The fetus depend upon the mother for oxygen and nutrition, and for the removal of carbon dioxide and other waste products. So what the thing is helping to the fetus to develop, that is placenta. In the mother womb we have placenta, one covering. In that we have baby. Okay, this is the fetus, and this is the placenta, which contains fetal and maternal blood vessels that are very close to the another. The blood of the fetus does not mix with the blood of the mother. Substances are exchanged by diffusion and active transport mechanism. So we have one transport mechanism, diffusion, higher amount to lower amount. Okay, likewise blood, nutritions, everything will go, oxygen will go, okay, with the help of placenta. The fetus is connected to the placenta. So the fetus is connected to the placenta by the umbilical cord, with the help of umbilical cord. This is the umbilical cord. Okay, two umbilical arteries and one umbilical vein. The umbilical arteries are branches of fetal internal iliac arteries that carry blood from the fetus to the placenta. In that placenta, carbon dioxide and waste products in the fetal blood enters maternal circulation and oxygen. So here we have two arteries and one vein. So baby having from that root, we have they have it have or fetus have two arteries that is named as umbilical arteries, and one is umbilical vein. Okay, the umbilical vein carries this oxygenated blood from the placenta to the fetus. Within the body of the fetus, the umbilical vein branches. One branches takes some blood to lateral liver. Most of blood passes through the ductus venous to the inferior vena cava to the right atrium after birth. When the umbilical cord is cut, the remains of these fetal vessels constrict the become a non-functional. The other modification of fetal circulation concern the fetal heart and large arteries, because the fetal lungs and are deflated and do not provide for gas exchange. Blood is shut down away from the lungs and to the body. The foraminal oval is an opening. So basically, all those things happen after the birth, and we will discuss in gynec section or obstetric in detail. Here we have to understood that basic thing, that in that thing we have understood that this is the placenta, this is the fetus. So fetus is connected to the placenta with the help of umbilicus or cord, umbilical cord. Umbilical cord have arteries, veins. Okay, after birth this will become non-functional. Placenta will come outside. Okay, so basically, so this is the thing which attached to the mother and giving nutrition, giving gas exchanges, giving all those required things what baby needs. Okay, so I think you understood about that. So basically, we have important areas where we have to check the pulse. One is, well, I told you that this is the radial pulse, very important. This is the wrist. Okay, this is the wrist. This is the bone. Here we have medial aspect, not medial, anterior, posterior aspect where we have the uh, bone. This is the thumb on the pathway of thumb, the carpals, metacarpals. Okay, these are the metacarpals. So wrist is there. So here we have the radial pulse. This is important in electrohomeopathy as well as acupuncture. In both things we have pulse diagnosis. And the most important pulse where we check during a person faint or he unconscious, this is carotid pulse. We have to check the pulse within 2 to 3 seconds. If the pulse is there, we have to, if the patient is unconscious or heart pain, chest pain, whatever, we have to give the CPR. Huh? Okay, card. This is carotid pulse and temporal pulse, femoral pulse. Okay, popliteal pulse, dorsal pedis pulse in the foot. So all this pulse will check, and how the importance of those check. Main is carotid pulse and radial pulse are checked during examination. Next, to have velocity of blood flow. So how the blood from the higher velocity to the lower velocity, how it will speed and how the speed is occurs. Is there any constant speed or speed decreases or speed increases? We will discuss. And we have very important thing, that is blood pressure. What is blood pressure? How it is going? How it is maintained? Very very important. And how it is maintained, very very important. Those things we have to understood, because nowadays blood pressure is very common. So we'll discuss all those things tomorrow. If any doubt, you can ask regarding that. So here we will discuss today about circulation, different types of circulation: hepatic, portal, fetal, systematic, and pulmonary circulations. The main important is pulmonary circulations, how the heart is receiving the blood, how a heart is pumping the blood, how it is reaching to the lungs, from the lungs to the heart, and heart to the whole body. Whole body systematic circulation, and in that we have very important portal circulation, because after digestion the blood will reach to the portal. Okay, very important. And we have fetal circulation, discuss about the basics. Any doubts? Can ask.